Picture this, waking up 3 times last night just to use the bathroom, feeling exhausted after walking to the mailbox, thinking it's just age catching up. But what if the heart is quietly sending warning signals that are being missed every single day? These aren't just random inconveniences. Welcome back to Health Bloom, the podcast where health conversations feel like sitting down with a caring friend over a warm cup of tea. This isn't about medical jargon or scary statistics. It's about understanding what the body is trying to communicate, especially after crossing that milestone of 60 years. Today's topic hits close to home for so many families. Heart weakness doesn't always announce itself with dramatic chest pain or a sudden collapse. More often, it whispers through subtle changes that get brushed off as normal aging. But here's the truth: recognizing these whispers early can be life-saving. Before diving in, here's a small request. If this conversation brings value or peace of mind, consider hitting that like button and subscribing to Health Bloom. Sharing this episode with someone who might need it could make all the difference in their life. Health information is most powerful when it reaches those who need it most. Let's start with something that might sound familiar. The body after 60 is different from the body at 40 or even 50. Things slow down, joints protest a bit more, and energy levels fluctuate. That's completely natural, but sometimes what seems like normal aging is actually the heart struggling to keep up. Heart weakness, or what doctors call heart failure, doesn't mean the heart has stopped. Think of it like a water pump that's been working for decades. Over time, it might not pump as strongly as it once did. The heart is still beating, still working, but not as efficiently. And when that happens, the body starts showing signs. Research indicates heart failure affects roughly 64 million individuals globally, making it a significant health concern for aging populations. The challenge is that many people dismiss early warning signs, attributing them to getting older. That's exactly why this conversation is so important. Knowing what to watch for can mean catching problems before they become serious. So what are these silent signs? Let's explore them one by one, understanding not just what they are, but why they happen and what they mean. This isn't about creating fear, it's about creating awareness. Knowledge is the first step towards taking care of the heart and ultimately towards enjoying more vibrant, active years ahead. Silent sign number 1, the exhaustion that won't go away. Everyone experiences tiredness after a busy day, after a restless night, after an intense workout. That's normal fatigue. But there's a different kind of tiredness that people with weakening hearts experience. This type of tiredness persists even after a full night's rest, creating a deep, unshakable sense of depletion that rest doesn't fix. Here's what's happening inside the body. When the heart can't pump blood efficiently, every cell in the body receives less oxygen and fewer nutrients. This creates an overall sensation of tiredness or fatigue. It's like trying to run a car on half a tank of gas. Everything just feels harder, slower, and more effortful. This exhaustion often shows up in unexpected ways. Maybe climbing those stairs to the bedroom suddenly feels like scaling a mountain. Perhaps that weekly trip to the grocery store now requires sitting down halfway through. Activities that used to be effortless now demand conscious effort and leave a person feeling completely drained afterwards. What makes this particularly tricky is that it happens gradually. The body adjusts bit by bit so it doesn't feel dramatic. One day, someone realizes they've stopped doing things they used to enjoy, not because they don't want to, but because they simply don't have the energy. That's when alarm bells should start ringing softly in the mind. The important distinction here is consistency. When the heart cannot supply enough oxygen-rich blood to satisfy the body's energy requirements, a pervasive sense of weariness develops. If this deep tiredness persists week after week, regardless of how much rest is being gotten, it's worth having a conversation with a healthcare provider. The heart might be working overtime just to keep things going. Silent sign number 2, breathing that feels different. Breathing is something we do automatically, without thinking, but when the heart starts weakening, breathing can be surprisingly noticeable. This symptom appears initially during physical activity and eventually manifests even at rest or while lying down. That progression is a key indicator something deeper is happening. The medical term is dyspnea, but it simply means shortness of breath. When a weakened heart cannot meet the body's oxygen demands, fluid accumulates in the lungs. Imagine trying to breathe through a slightly damp cloth. That's somewhat similar to what happens when fluid builds up in lung tissue. In the early stages, this might only happen during physical activity. Walking up an incline, carrying groceries, even having an animated conversation might leave someone feeling winded. Many people brush this off, thinking they're just out of shape, but when someone who's been reasonably active suddenly feels breathless doing routine activities, that's significant. As things progress, breathing difficulties can occur even at rest. Some people notice they can't lie flat in bed anymore because it makes breathing harder. This type of breathing trouble is labeled orthopnea, resulting from fluid that gathers in the lungs during reclined positions. They end up sleeping propped up on multiple pillows or even in a recliner. There's also something called paroxysmal nocturnal dyspnea, a fancy term for suddenly waking up gasping for air during the night. This occurs when accumulated lung fluid causes someone to wake up wheezing or struggling for breath. It's frightening, and it's definitely the body's way of saying the heart needs attention. Sitting up helps because gravity pulls some fluid away from the lungs. Breathing should feel effortless most of the time. When it doesn't, especially in situations where it used to be, that's the heart sending a message. Don't ignore it. Even if it feels embarrassing to mention feeling winded to a doctor, that information could be crucial for early detection and treatment.
Silent sign number 3. Swelling that appears out of nowhere. Swelling, or edema, as medical professionals call it, is one of the more visible signs of heart trouble. It typically shows up in the lower body, feet, ankles, and legs, but can also affect the abdomen. When the heart lacks adequate pumping strength to circulate used blood upward from the lower limbs, fluid tends to gather in the ankles, legs, thighs, and abdomen. Here's how it works. The heart's job is to keep blood circulating throughout the entire body. When it weakens, blood doesn't get pushed forward as effectively. This causes blood to back up in the veins, especially in the lower parts of the body, where gravity makes things harder. The increased pressure in these blood vessels forces fluid out into surrounding tissues. People might notice their shoes feeling tighter by the end of the day, or perhaps there's an indentation in the skin that stays for a while after pressing on the ankle or shin. Some folks find their rings getting tight, or their pants not fitting the same way around the waist. These are all signs of fluid retention. What's particularly important to watch for is sudden weight gain, not the kind that happens over months from dietary changes, but gaining several pounds in just a few days. That's not fat, that's fluid. Such rapid weight increases serve as red flags for fluid accumulation rather than actual weight gain. The body is literally holding on to water it should be processing and eliminating. The abdomen can also swell, feeling bloated and tender. This happens when fluid accumulates in the abdominal cavity, a condition called ascites. It can make eating uncomfortable and create a constant feeling of fullness. The digestive system might not work as well either because it's not getting the blood flow it needs to function optimally. Swelling shouldn't be ignored, especially when it comes on quickly or doesn't go away with simple measures like elevating the feet. It's one of those signs that clearly indicates the heart is struggling to manage the body's fluid balance. The earlier this gets checked out, the better the outcome tends to be. Silent sign number 4. The cough that won't quit. A persistent cough might seem like a respiratory issue, but it can actually be a sign of heart trouble. Fluid accumulation in the lungs may produce coughing, wheezing, and difficulty breathing. This isn't the kind of cough that comes with a cold and goes away in a week or two. This lingers, often getting worse at night or when lying down. The connection might not be obvious at first. When the heart can't pump effectively, blood backs up into the blood vessels of the lungs. This increased pressure forces fluid into the tiny air sacs where oxygen exchange happens. The lungs respond by trying to clear that fluid, which triggers coughing. It's the body's attempt to solve a problem. Sometimes this cough produces mucus. Persistent coughing that generates white or pink-tinted mucus might signal heart failure. The pink tinge comes from small amounts of blood mixing with the fluid. It's not usually dramatic bleeding, but it's definitely a sign that something needs medical attention. A dry, hacking cough is also common, particularly one that sounds wheezy. What makes this symptom confusing is that it mimics other conditions. Asthma, chronic bronchitis, or even acid reflux can cause similar coughing. But when a cough persists despite treatment for those conditions, or when it's accompanied by other symptoms like fatigue or swelling, it's time to consider the heart as a possible cause. Many people also experience wheezing with this type of cough. The airways can become narrowed due to fluid and inflammation in the lungs, creating that whistling sound when breathing. Again, it feels respiratory, but the root cause is cardiac. The heart's inability to pump properly creates a cascade of effects throughout the respiratory system. If there's a cough that's been hanging around for weeks, especially one that worsens when lying down or during the night, don't just chalk it up to allergies or getting older. Have a conversation with a healthcare provider about the heart. Sometimes what seems like a simple cough is actually a vital clue to something more significant happening. Silent sign number 5. Nighttime bathroom trips that multiply. This one catches many people by surprise. Increased urination at night, termed nocturia, occurs for a specific physiological reason. It might seem unrelated to the heart, but there's actually a clear connection that explains why this happens with heart weakness. Understanding this mechanism makes the symptom make perfect sense. During the day, when upright and active, a weakened heart struggles to pump blood effectively against gravity. Throughout daytime hours, the compromised heart cannot deliver sufficient blood to the kidneys, preventing them from adequately filtering excess bodily fluid. The kidneys are responsible for filtering blood and creating urine, but they need adequate blood flow to do their job. When blood flow to the kidneys is reduced during the day, they can't process and eliminate fluid efficiently. That fluid then builds up in the body's tissues, contributing to the swelling mentioned earlier. But here's where it gets interesting. At night, when lying down, gravity is no longer working against the heart. Blood flows more easily back to the heart and then out to the organs. This improved nighttime circulation reactivates the kidneys, which then begin processing the fluid that accumulated throughout the day. Essentially, the kidneys are catching up on their work while sleeping. The result? Waking up multiple times during the night needing to urinate. It's the body's way of finally getting rid of that excess fluid. 1 or 2 bathroom trips per night might be normal, especially with age. But when it becomes 3, 4, or more times a night, and when it's a relatively new pattern, that's worth investigating. It disrupts sleep, leads to fatigue during the day, and can significantly impact quality of life. More importantly, it's often a sign the heart isn't pumping effectively during waking hours.
Some people also notice that their urine output is greater at night than during the day. Again, that's because the kidneys are finally getting the blood flow they need to function properly. It's another one of those subtle signs that seems unrelated to the heart, but is actually deeply connected to cardiac function.
Understanding the bigger picture. These 5 signs, persistent exhaustion, breathing difficulties, swelling, chronic cough, and increased nighttime urination, rarely appear in isolation. More commonly, they show up in combinations, creating a pattern that points toward heart weakness. Healthcare professionals developed an acronym tool called FACES to help identify heart failure symptom combinations, making it easier for both doctors and patients to recognize when something serious might be developing. The challenge with all these symptoms is their subtleness. They creep in gradually, allowing the mind to rationalize them away. It's just age. Everyone gets tired. My parents had swollen ankles too. These explanations feel comfortable, but they can delay crucial diagnosis and treatment. The heart doesn't send dramatic distress signals in the early stages. It sends gentle nudges. Age does bring changes, absolutely, but there's a difference between normal aging and the body struggling with a weakening heart. Normal aging might mean taking a bit longer to recover after exercise. It might mean needing an afternoon nap occasionally. But it shouldn't mean feeling exhausted all the time, gasping for breath during routine activities, or watching ankles swell up overnight. Here's an encouraging truth. Heart weakness caught early can often be managed effectively. While heart failure caused by progressive heart damage cannot be cured, it can be managed through various treatment approaches that significantly improve quality of life. Medications can help the heart pump more efficiently. Lifestyle changes can reduce the heart's workload. In some cases, medical devices can support heart function. The key is not waiting until symptoms become severe. By the time someone is struggling to breathe at rest or has significant swelling throughout their body, the heart has already been working in a compromised state for quite some time. Earlier intervention means better outcomes, fewer hospitalizations, and more years of active, enjoyable living. It's also worth mentioning that these symptoms can have other causes besides heart weakness. Kidney disease, liver problems, thyroid issues, and various other conditions can produce similar signs. That's exactly why medical evaluation is so important. Self-diagnosis based on symptoms rarely leads anywhere good. What's needed is a healthcare professional who can run appropriate tests and determine what's actually happening. Speaking of tests, diagnosing heart weakness typically involves several steps. A physical examination comes first, where a doctor listens to the heart and lungs, checks blood pressure, and looks for signs of fluid retention. Blood tests can reveal certain markers that indicate heart stress. An echocardiogram uses ultrasound to create images of the heart, showing how well it's pumping. These are generally non-invasive and provide valuable information. The emotional aspect of this journey shouldn't be overlooked either. Suspecting or discovering that the heart isn't working as well as it should can be frightening. That fear sometimes keeps people from seeking help, but knowledge truly is power here. Understanding what's happening, why it's happening, and what can be done about it transforms fear into actionable steps. It shifts the narrative from helplessness to empowerment. Family members play a crucial role too. Adult children often notice changes in their aging parents before the parents fully recognize them themselves. Maybe mom is breathing harder during phone calls. Perhaps dad stopped going for his daily walks without mentioning why. These observations are valuable. Bringing them up gently, with love and concern rather than alarm, can open the door to important medical conversations. Taking action without panic. So what should someone do if they recognize one or more of these signs in themselves or a loved one? First, don't panic. These symptoms don't mean an emergency is happening right this moment, but they do mean it's time to schedule a conversation with a healthcare provider, not months from now, but reasonably soon, within days or weeks, not brushing it off indefinitely. Before that appointment, it helps to track symptoms. Keep a simple journal, noting when fatigue feels overwhelming, when breathing seems harder than usual, whether swelling increases by evening, how many times the bathroom gets visited at night. Concrete information helps doctors make better assessments. Instead of saying, "I'm tired sometimes," being able to say, "I've felt exhausted for 3 weeks, even after full nights of sleep," provides much clearer information.
Also note any other health conditions and medications currently being taken. High blood pressure, diabetes, previous heart issues, obesity, smoking history, all of these factors influence heart health and help doctors understand the complete picture. Being open and thorough with medical information isn't oversharing, it's providing the tools doctors need to help effectively. If symptoms suddenly worsen, severe shortness of breath, chest pain, rapid swelling, confusion, or dizziness, that's when emergency services should be called. Those are signs of acute decompensation, meaning the heart is in immediate distress. But for the gradual, subtle symptoms discussed here, a scheduled appointment with a primary care physician or cardiologist is the appropriate next step. Prevention also deserves mention. Not everyone can prevent heart problems entirely, especially if genetics play a role. But there are absolutely steps that support heart health and potentially slow or prevent weakening. A diet low in sodium helps manage blood pressure and fluid retention. Regular physical activity, even gentle walking, strengthens the cardiovascular system. Managing conditions like diabetes and hypertension reduces stress on the heart. Stress management matters too. Chronic stress takes a toll on every body system, including the heart. Finding healthy ways to cope, whether through meditation, hobbies, social connection, or professional support, contributes to overall cardiac health. Sleep quality matters as well. Poor sleep increases stress hormones and can worsen heart function over time. These aren't dramatic interventions, but they add up to meaningful protection for the heart. Smoking is perhaps the single most harmful habit for heart health. For anyone over 60 who still smokes, quitting provides immediate and long-term benefits to the cardiovascular system. It's never too late to stop, and the heart starts to heal remarkably quickly once smoking ceases. Support programs, medications, and counseling can all make quitting more achievable. Living well with heart awareness. Understanding these 5 silent signs isn't about living in fear or obsessively monitoring every bodily sensation. It's about developing an awareness, a gentle attentiveness to what the body is communicating. The heart is resilient and remarkably hard-working, but like any machine that's been running for 6 or more decades, it sometimes needs support. Recognizing when that support is needed makes all the difference. Living well after 60 means honoring the body's signals rather than dismissing them. It means having the courage to seek medical advice even when symptoms seem minor or embarrassing. It means being an advocate for personal health and the health of loved ones. These small acts of courage and awareness can literally save lives and preserve quality of life for years to come. The beauty of catching heart weakness early is that it opens up so many possibilities for intervention and management. Medications have come a long way in supporting heart function. Lifestyle modifications can significantly reduce the heart's workload. Regular monitoring helps catch any changes before they become crises. People live active, fulfilling lives even with managed heart conditions when those conditions are identified and treated promptly. This conversation about the 5 silent signs, exhaustion that won't lift, breathing that feels different, swelling that appears unexpectedly, persistent coughing, and nighttime bathroom trips, isn't meant to create anxiety. It's meant to create empowerment. Knowledge transforms uncertainty into action, fear into preparedness. If anything discussed today resonated or raised questions, please share this episode with someone who might benefit from hearing it. Heart health awareness saves lives, and sometimes all it takes is one conversation to encourage someone to seek the care they need. Hit that like button if this information felt valuable, and subscribe to Health Bloom for more caring, practical health conversations. Remember, the body is wise. It sends signals when something needs attention. Listening to those signals with compassion and taking appropriate action is one of the greatest gifts of self-care. The heart has been beating faithfully for decades. It deserves attention, respect, and proper care.
Taking that first step towards understanding and addressing any concerns is an act of self-love that ripples out to affect everyone that matters. Until next time, stay curious about health, stay compassionate with the body, and remember that Health Bloom is here, offering guidance like a caring friend. Take care of that precious heart, and it will continue taking care for years to come.